What is chronic fatigue syndrome? Chronic fatigue syndrome, CFS, or myalgic encephalomyelitis is an illness characterized by profound disabling tiredness, a diminished capacity to perform routine tasks, and sleep disruption that lasts for more than 6 months. Based on prevalence estimates from the Institute of Medicine, chronic fatigue syndrome affects around 0.2 to 2.6% of the global population. It mainly affects adults between 40 and 60 years, with a female predominance. It also occurs in children and adolescents, however, it appears to be at a lower rate. What causes chronic fatigue syndrome? There are several causes of chronic fatigue syndrome, including genetic, neurological, immunological, infectious, sleep-related, and psychiatric. 1. Chronic fatigue syndrome and genetics. Several studies investigated the association between chronic fatigue syndrome and phylogenetic history. One of the studies compared the rate of chronic fatigue syndrome, CFS, between 25 individuals with CFS and 36 control subjects and found significantly higher rates of CFS in individuals with CFS relatives. By analyzing data from a chronic fatigue twin registry, other studies found higher rates of chronic fatigue syndrome in monozygotic, identical, compared to dizygotic twins, and that a genetic predisposition to chronic fatigue syndrome exists in female twins. However, further investigations are required to confirm the involvement of family genetic history in the etiology of CFS. 2. Chronic fatigue syndrome and neurological conditions. Due to the presence of symptoms of fatigue, impaired concentration, diminished attention and memory, and headache in cases of CFS, neuropsychological and neuroendocrine studies were performed by several research groups. Although the studies tested the capacity of information processing, working memory, and poor learning in CFS individuals, the results showed that these individuals have normal cognitive and global intellectual abilities. Abnormalities in the hypothalamic pituitary adrenal axis and serotonin pathways were reported in patients with CFS. These individuals had an altered physiological response to stress associated with reduced levels of cortisol, a disorder of central neurotransmitters, and disturbance of the functional relationship between cortisol and central neurotransmitters. 3. Chronic fatigue syndrome and immunological conditions. Analysis of the immune system in CFS individuals demonstrated the presence of alterations affecting the function of natural killer cells and regulatory T and B cells, and higher frequencies of various autoantibodies. However, other studies showed the absence of changes in lymphocyte subsets in CFS individuals. 4. Chronic fatigue syndrome and infections. Although several studies reported potential associations between CSF and viral infections, such as Epstein-Barr virus, cytomegalovirus, human herpes virus 6, HHV7, HHV8, human parvovirus B19, enteroviruses, lentiviruses, the role of viral infections in CSF etiology have not been confirmed and remains inconclusive. 5. Chronic fatigue syndrome and sleep disruption. Although many studies suggested an association between CSF and sleep disturbances, a recent study showed that the reported results are inconsistent due to subjects' recruitment decisions, confounding factors, small sample sizes, and unconfirmed findings. 6. Chronic fatigue syndrome and psychiatric conditions. Several studies suggested that CSF is a psychiatric disorder that originates in CSF individuals who had mood disorders such as anxiety and major depression, and somatization disorder that includes symptoms such as headaches, dizziness, generalized pain, bowel movement, and fatigue. 7. Chronic fatigue syndrome and of lack of exercise. A study showed that CSF individuals have less physical activity than non-CSF individuals, suggesting that the lack of physical activity could aggravate fatigue in CSF patients. Interestingly, another study showed that individuals with CSF who received a graded exercise program had improvements in physical activities and in some cognitive variables. How is chronic fatigue syndrome diagnosed? Unfortunately, there is no specific test for CSF, and the diagnosis is based on the observation of symptoms including sleep disturbances, headaches, joint and muscle pain, disabling tiredness, flu-like symptoms, dizziness, and heart palpitations. How is chronic fatigue syndrome treated? The treatment of chronic fatigue syndrome is symptomatic and involved the use of a graded exercise EPROM to improve physical activity, medications to control sleeping disruptions and pain, and cognitive behavioral therapy to improve cognitive disorders, behaviors, and to develop coping strategies. In conclusion, although chronic fatigue syndrome appears to be associated with psychiatric and neurological disorders, other factors such as viral infections, immunity, and heredity may also be involved. A better understanding of the etiology of this syndrome using studies that comprise larger cohorts of CSF patients would certainly lead to the development of more efficient therapies that are specific to chronic fatigue syndrome. If you enjoyed the video, please like, subscribe, and share for more videos like this.